Hello students. So in the last class we learned about nursing assessment in the nursing process. So the second phase of this nursing process is regarding the nursing diagnosis. So now what is this nursing diagnosis? So it is a second phase of nursing process. Okay, it is a pivotal step in nursing process. North American nursing diagnosis. Okay, they that is called NANDA, North American nursing diagnosis. So every 2 years they change the nursing diagnosis. So like there will be some kind of modification will be done by this NANDA association. So this was begun in 1982. So these nursing diagnosis is very much important. You have to be quick enough to understand the patient's problem and quick enough to formulate the nursing diagnosis. So for that you should know what is this exactly nursing diagnosis and what are the components and what are the different steps belongs to it. Okay, so the purpose of NANDA is to define, refine and promote a taxonomy of nursing diagnostic terminologies. So there are different set of nursing diagnosis. Okay, there are different set of terminologies used. So what they do, the Nanda Association, they will refine as well as they define the nursing diagnosis, and they will send it. Okay, in the what to say, it is available in the Google. Okay, there are so many websites, so you can download that copy and you can keep it whenever it is needed. You can follow that. Then taxonomy is a classification system or set of categories arranged based on a single principles. So in 2000, taxonomy 1 revised to taxonomy 2. Okay, so currently approved there are 13 domains and 47 classes and 247 nursing diagnoses are there. So what is the definition of this diagnosis? Diagnosis is a statement or a conclusion regarding the nature of the phenomenon. Okay, it is one of the statement or a conclusion. After assessing, you'll come to a conclusion what exactly the patient is suffering from. So it is the statement or conclusion regarding the nature of the phenomenon. Then diagnostic label, the standardized Nanda names for the diagnosis are called diagnostic labels. So remember, these terms are very much important. So it is a names for the diagnosis are the they are called diagnostic label. So in 1990, Nanda adopted an official working definition of nursing diagnosis. Okay, it is the clinical judgment about nursing diagnosis. It is a clinical judgment about individual, family, or community responses to actual or potential health problem. A nursing diagnosis provides the basis for the selection of nursing intervention to achieve the outcome for which the nurses are accountable. Professional nurses are responsible for making nursing diagnosis. So throughout your nursing course, you have to understand and know what is this nursing. You have to follow the nursing process. So in the whole nursing process, nursing diagnosis is very much important. So when you after collecting the data, assessment will be easy, but the nursing diagnosis you have to somehow learn by heart. Okay, how to formulate it and what are the terms used, you have to know it by heart. Okay, um, I'll give you the copy of that so you can follow that, you can revise that, and it'll be easier, not to worry. Okay, so there are different domains. Okay, so 13 domains are there regarding the health promotion. So under health promotion, you have several nursing diagnoses. Again, under nutrition, suppose if the patient is having improper nutrition or the patient is malnourished. So under this nutrition domain, there are several nursing diagnoses which has been formulated by Nanda. Okay, elimination, exchange, activity, rest. I can tell you it's regarding fall when the patient has a fall or any accidents, okay, because of the fracture of the leg. So what are the different nursing diagnoses you can formulate, it will be helpful. Okay, all those diagnosis comes under this domain. Then role relationships, coping or stress, life principle, safety, these are the different domains. Okay, what are the characteristics of nursing diagnosis? So it states the clear and concise health problem. It derived from the existing evidences about the client. It is potentially amenable to nursing therapy. Okay, it is the basis for planning and carrying out the nursing care. So, what are the different types of nursing diagnosis? So, you should remember this. Actual nursing diagnosis, you have the risk nursing diagnosis, you have health promotion nursing diagnosis, possible nursing diagnosis, and syndrome nursing diagnosis. So, altogether there are five types. Okay, the actual nursing diagnosis comes first, then comes the risk nursing diagnosis. Usually, risk nursing diagnosis we use later because it is not seen, but you're anticipating that the patient might get. So that is why, according to the priority, it goes when you formulate the nursing diagnosis for the patients. Okay. So now, what is this actual nursing diagnosis? Okay, so it is the clinical judgment about the human experience's responses to the health condition. So actual client problem. What is the present client's problem? It could be pain, or it can be like patient is not able to breathe properly. So these are the actual complaints the patient is having at present. So that is the actual nursing diagnosis. So for that, how you have to formulate is, it is based on the presence of signs and symptoms. So, for example, one of the or two of the nursing diagnosis we can tell you is, if the patient is having no proper breathing pattern, if he is having breathlessness, if he is having difficulty in breathing, that time you can formulate the actual diagnosis as ineffective breathing pattern. Okay, ineffective breathing pattern. Or if the patient is not having proper sleep in the night, or okay, so for that, disturbed sleep pattern. So this is the pattern you have to follow. This is the you have to follow like this. If the patient is having breathlessness or breathing difficulty, you have to write ineffective breathing pattern. So if the patient is having no proper sleep, then disturbed sleep pattern. So this is how it comes for the actual nursing diagnosis. So next is regarding the risk nursing diagnosis. So it is a clinical judgment that a problem doesn't exist, but the presence of risk factors indicates that a problem is likely to develop. Okay, there are possibilities that the problem is likely to develop. It is not present at the moment. So for that, the nursing diagnosis will be, see, if a client is with a diabetes mellitus or sugar, diabetes mellitus, or compromised immune system. So what you can say is, there are possibilities that the diabetic patients will have what to say, decreased immune system. Okay, so they are very at risk at infection, or they are very risk for injuries. Okay, then health promotion nursing diagnosis. Okay, health promoting health. So readiness for enhanced family coping, or readiness for enhanced self esteem. So this describes the human responses to level of wellness in an individual, family, or community that have a readiness for enhancement. So clinical judgment about a person's families or communities motivation and desire to increase well-being. So possible nursing diagnosis is one in which evidence about a health problem is incomplete or unclear. A possible diagnosis requires more data either to support or to refuse it. So, for example, possible social isolation related to unknown etiology, potential risk of constipation as a result of enforced bed rest. So, these are the possible nursing diagnosis. Next is regarding the syndrome nursing diagnosis, a clinical judgment describing a specific cluster of nursing diagnosis that occurs together and are best addressed together and through similar interventions. So, rape trauma syndrome means cluster of signs and symptoms will be seen together, cluster of problems seen together. So, you can write rape trauma syndrome. That's it. Okay, so there will be, your care will be according to the nursing diagnosis. Okay, so that's about the types of nursing diagnosis. We learned about the actual nursing diagnosis, risk, health promotion, possible nursing diagnosis, as well as the syndrome nursing diagnosis. So next is regarding the components of nursing diagnosis. So you have the problem and its definition, the etiology, then defining characteristics. So the problem statement describes the client's health problem or response for which nursing therapy is given. The diagnostic label should be specific. Each diagnostic label approved by Nanda carries a definition that clarifies its meaning. Okay, so qualifiers are the words that have been added to some Nanda labels, like deficient, impaired, ineffective, decreased, acute, chronic, imbalanced, interrupted. So these are the problem. The thing is, the nursing diagnosis has three problems. Okay, three components. First is the problem, then is the etiology, and then is the defining characteristics. That means, in simple words, if I have to tell you, the problem and its definition means the first one: decreased, increased, impaired, interrupted, like that. Etiology is what is the reason behind the problem. Defining characteristics means what are the signs and symptoms. Okay, what is the proof of this problem? That is a defining characteristics. Okay, then etiology means it identifies one or more probable causes of the health problem. It enables the nurses to be individualized client care. So constipation, anxiety, so these are the etiology. um, Sorry, problem, constipation and anxiety. So for that, etiology will be long-term laxative use. Because of the long-term laxative use, the problem has, the patient has got constipation. So because of the threat to physiologic integrity or possible cancer diagnosis, the patient is anxious. So these are the etiology. Next is regarding the defining characteristics. The cluster of signs and symptoms that indicate the presence of particular diagnostic label. So you have the actual diagnosis as well as the risk nursing diagnosis. So client signs and symptoms, no subjective signs are present. So these are the defining characteristics. Okay, so that's about the diagnosis. So in the next class, we will learn about the diagnostic process. Okay, what are the steps that you use for the diagnostic process? So I hope you have understood. Until then, if you have any doubts, ask me. Okay.